Good morning, Pembelt, and good morning, our YouTube friends. We eventually get our particle count meter that can reading particles PM10, PM2.5, PM1, PM2.5, and zero point 0.3. It basically they categorize all the particles. They give you a particle count number per liter. So I was in Broadway this morning, and I tested the air. We get PM 2.5 around 15 microgram per liter. That's it put like air quality like an average. The best quality air in the world can be around 1 to 2 microgram per liter, microgram per meter. Yeah. And so if you break down the particles, 1 micron particle around 2,000 particle per liter, 0.5 around 10,000 particle per liter, and 0.3 it's a very ultra fine particle. That's basically like a virus size, around 20,000 particle per liter. So that's kind of like the air. We're actually in the main traffic road. You can see that traffic will affect the air quality. And when we put this nasal filter, I put this nasal filter on the meter. So what the meter work is, it has an internal pump. It's constantly pumping the air into the detector. They measure the air, so it's very accurate accuracy with the no pump compared with the no pump meter. And when we put this nasal filter around it, and the pump receptor is a cylinder type, so with the nasal filter it's hard to seal. So if you manage to seal really well, and the particle count around the PM 2.5 is almost zero. You will see low than 0.5. So that put a category, the air is better in the cleanest air in the planet. You know, you talk about any countries, the air is more cleaner than there. And 1.0 micron particle count now become less than 10 particle per liter, and for the particle around 0.5 micron is less than 100, and for particle 0.3 is less than 200. You can see that the particle count just decrease around tremendously, around 100 times with this simple nasal filter. So that's why we see the nasal filter is a game changer to protect you when you go outdoor. And you breathe in more higher quality air than your indoor. Even inside your house, you don't have that kind of quality air. So I will test him with different business like a hospital and restaurant, warehouse and supermarket. Try to see what's the actual quality level there. They will be better than on the street, but they are not as close as after the nasal filter. So we advocate healthy breathing. We advocate that you through a layer protection for your lung, and after the filter, you get less threat to your lung. And 2,000 particle per liter for 0.3 micron, that equal to around 300 million particle per day. If you're breathing calm, like a 300 million particle per day. So with the years accumulated, you can see that's a lot of the particle inside your body. It can cause inflammation and also can get into the bloodstream, cause local inflammation or or other. And most worse, like there are some chemicals attract on this particle side. They become inside, small size that can be cause damage, cause mutation, and that'll be enough for some kind of cancer source. So we learned about in East Asia, they have most high rate for the lung cancer for non-smoke, and people with a non-smoke has a high rate, and especially women with a non-smoke. That's related to the cooking behavior. Yeah, in East Asia, they cooking the heavy fuels cooking in the household. So breathing is the big thing. Breathing is really big thing. So we continue making more videos and talk about the breathing, talk about the particle count, and talk about the health associated with breathing. So thank you to watch this video. If you like it, please subscribe our channel. We will discover leader journey to and will all aspects about breathing to our health, and also how to protect ourselves to breathing healthy. Thank you. This is Dr. Young, inventor of PSC needle filter. I'm at Hattiesburg, Mississippi. We invent this needle filter through the COVID time. We believe this is a game changer for public health. We save many people's life and breathing high quality life to many people. Thank you.